Hello, my name is Doreen Hughes, and today I'm going to present Getting Started with ICD-10-PCS Basics. ICD-10-PCS stands for International Classification of Diseases, 10th Revision Procedure Coding System. This replaced Volume 3 of ICD-9-CM. The ICD-10-PCS is used to report inpatient procedures and was developed by the Centers for Medicare and Medicaid Services, CMS. ICD-10-PCS was started in 1998. First, let's look at your books. If you have your book handy, go ahead and get it out. In the front of your book, you will find an introduction, an index, ICD-10-PCS official guidelines for coding and reporting, ICD-10-PCS tables, and appendixes. The introduction is very important as it tells you who and why the procedure codes were developed. This section is often on certification tests. Hint, hint. The PCS book does not have a tabular section, but it does have an index. The purpose of the alphabetic index is to locate the appropriate table that contains all information necessary to construct a procedure code. The ICD-10-PCS tables should always be consulted to find the most appropriate valid code. There are also official guidelines for coding and reporting, and the appendixes are a great resource and even has questions and answers to help you learn the book and to keep up with your skills. Uniform Hospital Discharge Datasets, HUDDS. How many of you have heard of this organization? And what is the purpose of UHDDS? Well, UHDDS allows the government and healthcare facilities to gather comparable data that can be used to improve the delivery of healthcare services. This applies to acute care hospitals and facilities, short-term care, long-term care, psychiatric hospitals, rehab facilities, nursing homes, and hospice services. As a coder or CDI, do you always have to reference the ICD-10-PCS alphabetic index first to find the procedure code? No. The PCS table should always be consulted to find the most appropriate valid code, and then you can go from there. In many cases, the index lists only the first 3 or 4 characters of a code. The coder must look at the tables for the remaining digits. For example, in your book you could have excision gallbladder, which is 0FB4, or resection gallbladder, 0FT4. In the ICD-10-PCS procedure code assignment, which takes precedence, the conventions or the official coding guidelines? The instructions and conventions in the code set take precedence over the guidelines. Excuse me. The ICD-10-PCS coding guidelines provide additional instruction. The conventions of the coding system are the basis for all coding decisions, followed by the guidelines and any guidance published in the coding clinic. Okay, first let's look at your book. Let's understand this book. In your coding book, your PCS book, there are 7 characters that represent a full code. All 7 characters must be specified to be a valid code. If the documentation is incomplete in the coding purposes, the physician should be queried for the necessary information that is missing. Each character has up to 34 different possible values, and each character consists of digits 0 through 9 or letters A through H, J through N, or P through Z. The letters O and I are not used as they can be confused with the digits 0 and 1. Classification is divided into 16 sections relating to the type of procedure. This system allows for expansion of new values that may be needed in the future. My recommendation for you is to get some tabs and go through and tab your book completely through. You want to tab your indexes, your coding guidelines, your procedure codes, all the root operation codes. You want to go through so that you can find it very easily. Go through and do it by body part. Just put a tab wherever it is so that you can quickly find it. In the alphabetic index and tabular listing with procedures is divided into 17 sections of the code tables. These 17 sections, like I said, are represented by 0 through 9, or the letters A through H, J through N, and P through Z. The ICD-10 code consists of 7 characters. Each character has a different section, and we'll go through that in just a minute. These tables are arranged in alphanumeric order based on the first three characters of the 7-character code. And this will make more sense as we go through it. 75% of all PCS codes start in the 0 section for medical surgical. So most of your procedures are going to be in the medical surgical, so they're going to start with a 0. In section 1, in section character 1, in the section of obstetrics, section placement, you have character 2. Administration is character 3. Measurement and monitoring is character 4. Chiropractic 9. Imaging B. Nuclear medicine C. Radiation therapy D. Physical rehab and diagnostic audiology F. Mental health G. Substance abuse treatment H. And new technology X. Here are our ICD-10-PCS characters. Remember, I said there were 7. Each one has a different group. So in number 1, it's going to be your section. So like we said, 75% of the PCS codes are in the medical surgical section. This is where your 0 would fall in. Next, character 2 is your body system. Character 3 is your root operation. Character 4 is your body part. Character 5 is the approach. Character 6 is the device. And character 7 is the qualifier. Codes are built from left to right. So you start with the 1 and you go to the right. The tables and characters are arranged first by number and then by letter for each character. So you could have 0, 0, 0, 1, 0, 2, etc. Or sometimes you might have 0B, 0C, 0D, or 0B1, 0B2, or 0BB, 0BC, 0BD. These are on the left side of the page. Listed underneath the first 3 characters is a table comprising 4 columns in 1 or more rows. The 4 columns in the table specify the last 4 characters needed to complete the ICD-10-PCS code. Here is an example. Look at the top left. Here we have our section. That was section 1. It's 0. We're going to do a medical surgical section. Next is our body system. It's a 0. We're going to do central nervous system. Next, our root operation, we're going to do a bypass, which is a 1. Bypass is altering the route of passage of the contents of a tubular body part. Body part is character 4, so we can either do cerebral ventricle, which is a 6, or spinal canal, which is a U. You have to stay in your column as you go across to the right. You can't be down in spinal column and then shoot up to 0 nasopharynx in character 7. You have to go across, left to right, all the way across. So here, our code is 001. Let's say we're going to do spinal canal. We're going to have a U. Our approach is open. We have, stay in our column. We come straight across. Device, character 6. Well, let's do non-autologous tissue substitute K. And then our qualifier, character 7, let's say we're going to say 4, pleural cavity. So our whole code would be 001U0K4. That would be our complete code. This is a whole lot simpler to me than CPT coding. Okay, next we have the definition of each character. Character 1, section. Again, this is your med surgical section or your obstetric section, radiology, any of those. Character 2 is your body system. Last time we did central nervous system. This character identifies the general anatomical or physiological system involved in the procedure. The diaphragm is the dividing line of the body part values classified as upper or lower, upper veins or lower veins. So think of your diaphragm as the equator of your body. So anything above your diaphragm is upper. So you have upper bones, upper joints, upper veins, upper arteries, or you have your lower bones, lower veins, lower joints, lower arteries. Very easy to remember, diaphragm, your equator of your body. Character 3 is your root operation. There are, I believe, like 31 root operations, so we'll go through those shortly. This character identifies the objective of the procedure. Definition of each character continue. Character 4 is your body part. This tells which part of the body is having surgery performed on it. Character 5 is the approach. How are they doing the surgery? Are they doing it open? Are they doing it closed? Character 6, device. This character identifies the device, if any, used in the procedure. This is very important. A device is defined as the material or appliance used to accomplish the objective of the procedure that remain in the body or on the body or the procedure site at the end of the procedure. So they have to keep it in there at the end of the procedure or it doesn't count. Definition of each character continued. We're on character 7 now, which is the qualifier. This character provides additional information in certain cases. For example, the qualifier of diagnostic is used to identify the procedure as a biopsy. Most codes have a Z, which means no qualifier in the 7th character position. If you don't have a qualifier, you can't just leave it blank. It has to have 7 digits in there. So you have to have alphanumeric digits in your code set. So last time we had 001, and then we went down to, let me go back, to U, then 0, then K, and then we did 4. So we have to have all the characters have to have a letter or an alphabet in there. Okay, the obstetric section is a little bit different. On the obstetric section, you report procedures that perform only on the products of conception. So it is only on the products of conception. Even moms don't count. It's the contents of the conception that count. That goes in the obstetric section. According to the ICD-10-PCS guidelines, the products of conception refer to all the physical components of a pregnancy. So these components include the fetus, the amnion, the umbilical cord, the placenta. These guidelines instruct the coder that when a procedure or procedures are performed on a pregnant female, but not on the products of conception itself, then the procedure is coded to a root operation of medical surgical section. If, however, the surgery is performed on the fetus, the amnion, the umbilical cord, or the placenta, then it goes to the obstetric section. And here's an example. Amniocentesis is coded to the products of conception body part in the obstetric section because that's part of the products of conception. However, the repair of the obstetric urethral laceration, that tear that mama got, we got to sew it up, is coded to the urethra body part in the medical surgical section because it does not have anything to do with the products of conception. Procedures performed following delivery or abortion. Procedures performed following a delivery or an abortion for sertage of the endometrium or removal of retained products of conception are coded to the obstetric section. Using the example referred to, the root operation extraction and the body part products of conception retained. Any diagnostic or therapeutic dilation and sertage that are not performed in the postpartum or post-abortion period are coded using the root operation extraction in the medical and surgical section. Okay, now I have some questions for you. As a CDI or coder, do you always have to reference the ICD-10-PCS alphabetic index first to find the procedure code? No. Only the PCS tables should always be consulted to find the most appropriate valid code. Number 2, in ICD-10-PCS, to obtain an accurate procedure code assignment, which takes precedence over the other? Is it the coding conventions or the official coding guidelines? The instructions and conventions in the code set take precedence over the guidelines. Remember, the conventions are the instructions. The ICD-10-PCS coding guidelines provide additional information. So the guidelines provide additional. The conventions of the coding system are the basis for all coding decisions, followed by the guidelines and any guidance published in the coding clinic. Number 3, what does the 5th character of the ICD-10-PCS code specify? Remember, we have 5 characters. What is that 5th character? What goes in that spot? It is the approach, the technique used to access the operative site. Number 4, what approach is assigned for a closed reduction of a fracture? External. This approach is performed either directly on the skin or mucous membranes or indirectly by the application of force. Number 5, if a device is not applicable to a given code, what character is used as a placeholder? Do you leave it blank, use a 0 as a placeholder, use an X character, or do you use a Z character? That's right, you use a Z character. More questions. Number 6, which one of these is considered a device? A Foley catheter, suture, radiological marker, or temporary post-operative wound drain? Surprisingly, it's the Foley catheter. Number 7, amniocentesis is coded to the products of conception body part in the obstetric section. True or false? That's true. Remember, obstetrics, anything that has to do with the conception of products of conception goes into obstetrics. Number 8, if a patient with a long history of emphysema presents for an endobronchial valve placement, a flexible fiber optic bronchoscope is introduced via the nose and is advanced into the bronchus of the right lower lobe. Which ICD-10-PCS root operation would you code? Insertion. Okay, number 9, what is the procedure code? The procedure code for number 8 would be 0BH68GZ. The fourth character, 6, identifies the body part as the right lower lobe bronchus. The fifth character, 8, identifies the approach or technique used to reach the operative site as via natural or artificial opening endoscopic. The sixth character is G, introduces the device as an endobronchial valve, and Z is the placeholder. Number 10. A left upper lobe lobectomy is coded. What is the root operation? A left upper lung lobectomy is coded to resection of upper lung lobe. Resection is coded when all of a body part is cut out or off. Let me repeat that. Resection is coded when all of a body part is cut out or off. Excision is cutting out or off without replacement a portion of a body part. Excision is only a portion of a body part removed. Resection is all of a body part removed. Questions continued. Number 11. What is the root operation that cuts out solid matter from a body part, such as removing a clot? Extirpation. Number 12. What is the root operation that alters the route of passage of contents of a tubular body part? Bypass. Remember, tubular bypass. And number 13. What is the root operation that takes out fluids or gases from a body part, such as a needle biopsy? Drainage. Now, I know we haven't covered some of these, but these are some questions that are good for yourself and new coders and CDI that are just learning. You can get them to use the book more. Next, I have the answers to the questions in case you're just printing off this PowerPoint and you want to share it with others. There's also answers on here. Now let's go to our appendix. Appendix A talks about the root operations. This is your third character on you building your code. There are 31 root operations. We're going to go over each one of these and explain how you can differentiate them from one another. Remember, excision is the cutting out or off without replacement of a body part. That was a portion of the body part. So an example of excision would be like a breast lumpectomy. You're taking only a portion of the breast, just that lump. Resection is the cutting out or off without replacement of a body part. This would be your example of a total mastectomy. You're taking the whole breast. That is resection. Okay. Root operation definitions. The root operations that take out all or some of a body part, there are 5 of them. The first one is destruction. It's noted by 5. It's eradication of all or a portion of a body part by direct use of energy, force, or a destructive agent. Here is your fulguration of endometrium. Here there's a picture here. I don't know if you can see it very well, but it has like an ablation. It has the wire that goes up into the uterus and it connects all the walls. And so it destroys its destructive agent on the walls of the endometrium. Next one is 6. It's detachment. It's cutting off all or part of an upper or lower extremity. So you think of your detachment, you're thinking of your above the knee amputations or below the knee amputations. You could have finger or toe amputations. This is your cutting off all or a part of an extremity. Next is excision. It's noted by B. Cutting out, off, without replacement, a portion of a body part. Again, your breast lumpectomy, you're taking out a portion. Extraction is pulling or stripping out or off all or a portion of a body part by use of force. This is your suction D&C, your vein strippings. And there's pictures of veins that are being stripped. Next is resection. It's noted by the letter T. It's cutting out or off without replacement all of a body part. Again, this is your total mastectomy. Here in this picture is where we took out a whole section of the intestine and then they put it back together. So they removed a whole section of it. Or you have your total nephrectomy or your total lobectomy of your lung. Next root operations are taking out solids, fluids, gases from a body part. We have 3 of those. We have drainage, which is taking out or letting out fluids or gases from a body part. This is your incision and drainage, your thoracentesis. And here's an example of a thoracentesis. You have fluid kind of at the bottom of the lung lobe. So they stick a needle in and they drain the fluid out. Next is C, extripitation, is taking or cutting out solid matter from a body part. This is your thrombectomy, removing of a blood clot, and that's what a picture of here is. There's a blood clot and they're sucking it out there, extripitation. This is also your endarterectomies. Next is fragmentation, which is noted with an F, breaking solid matter in a body part into pieces. This is your lithotripsies that they do for the kidney stones. Okay, our next group of root operations involve cutting or separation. We have division, which is noted by an 8. It's cutting into a body part without draining fluids or gases from the body part in order to separate or transect a body part. Here is a picture of the knee. They're taking a wedge out of the knee. So they're cutting into a body part without draining fluids or gases. N is release. It's freeing a body part from an abnormal physical constraint by cutting or by use of force. This is your lysis of adhesions, your carpal tunnel release. Next, root operations that put in, put back, or move some or all of a body part. We have 4 of those. We have reattachment, which is noted by an M. It's putting back in or all of a portion of a separated, detached body part to its normal location or other suitable location. So here's your reattachment of a finger, your reattachment of a hand. So you can see on a picture of the finger how it's sewn back on. Next is reposition, which is noted by an S. It's moving all or a portion of a body part to its normal or other suitable location. Reposition of undescended testes. A fracture reduction. Here you have someone holding the person's elbow. The doctor is in front and they're going to both pull at the same time to get the bone back in line without surgery. So that's fracture reduction. Very painful. Next is transfer. It's noted by an X. It's moving without taking out all or a portion of a body part to another location to take over the function of all or a portion of a body part. This is your skin grafts, your skin transfer flaps, and this is a picture here of a skin graft taking, I think they usually take it from a larger part of your body, so it could be your back. They could use it from your leg, your thigh, whichever has the most skin, usable skin. Transplantation is noted by Y, putting in or on all or a portion of a living body part from a person or animal. And here's your transplants. So you have your kidney transplants, your heart transplants. Your next root operation involves examination only. This is inspection, which is presented by J. It's visual or manually exploring a body part. So here we're looking at a diagnostic cystoscopy where we're just looking in exploratory laparotomy. We're just visualizing, we're going in and we're looking. And you can see how they have the tow cars that are going into the body so that they can get their instruments in there to look around, and a camera, and it's up on the screen. Next we have MAP, which is a K. It's locating the route of passage of electrical impulses and or locating functional areas in a body part. This is your cardiac mapping. Here in this picture you can see they look to see how the valves are working, how the blood is being pushed through, how its output is. Next are root operations that alter the diameter of a tubular body part. We have 4 of those. Bypass is represented by the number 1. It's altering the route of passage of contents of a tubular body part. This is your cabbage and your colostomy formation. Dilation is represented by the number 7. It's expanding an orifice or lumen of a tubular body part. Here's your PTCAs. Here you can see they're going in and they're dilating the area so that they can get the blood to go through. It's very tiny, then they push it through and then it opens up. Occlusion is represented by the letter L. It's completely closing an orifice or the lumen of a tubular body part. This is your fallopian tube ligations. As you can see in this picture, they take the fallopian tube and they clamp it. Oftentimes they'll cut it. They show it in here. This is your occlusion. They're occluding it so that that tube will not work. Next is restriction. It's with a V. It's partially closing an orifice or the lumen of a tubular body part. This is your gastroesophageal fundoplication and your cervical cerclage. Here in this picture you can see that the cervical area started opening, started widening. It wasn't time yet. The baby's not old enough, it's not turned correctly, so they'll go in and kind of tie it off. So that's a restriction. They're closing it until it's ready for the baby to be born. Next, our root operation involves a device. Here we have 6. We have change, which is represented by 2. Taking out or off a device from a body part and putting it back an identical or similar device in or on the same body part without cutting or puncturing the skin or mucous membrane. This would be your drainage tube change, your urinary catheter change, your gastrostomy tube change. So you're just changing out the device. Next is your insertion. It's represented by an H. It's putting in a non-biological device that monitors, assists, or performs or prevents a physiological function but does not physically take the place of a body part. Here are your central line insertions, your insertion of radioactive implants. Removal is represented by the letter P. It's taking out or off a device from a body part. Central line removal. Here they're just taking the line out. You want to make sure that the tip of the catheter is intact. You have drainage tube removal. You want to make sure that the whole drainage tube is intact. Same thing with pacemaker removal. You want to make sure that you've got all your leads, that everything comes out intact. So that's removal. Replacement is an R. It's putting in or on biological or synthetic material that physically takes the place and or function of all or a portion of a body part. This is your total hip replacements, your bone grafts. And this is a picture of a total hip that has been replaced. Next is revision, represented by the letter W. It's correcting to the extent possible a malfunctioning or displaced device. This is the revision of a pacemaker insertion. So remember, if we took a pacemaker out, so we removed it because the lines maybe weren't working or weren't in the right place, and then we repositioned or revisioned. We did a revision of the pacemaker insertion, so we're replacing it in. We're doing a revision of it. It would go under W. Next is supplement U, putting in or on biologic or synthetic material that physically reinforces and or augments the function or a portion of a body part. This is your abdominal wall hernia repair with mesh, your free nerve graft. You're trying to put the mesh in, you're reducing the hernia and putting a mesh in the front. Root operations that define other repairs, we have two. We have control, which is represented by the number 3. It is stopping or attempting to stop post-procedural or other acute bleeding. Example is post-prostatectomy bleeding control, control of post-tonsillectomy hemorrhage. This is a picture of cautery, so they can cauterize. Next is repair. It's represented by a Q. It's restoring the extent possible a body part to its normal structure or function. You have suture lacerations, hernia repair without mesh, and this is a picture of some sutures. Okay, our next root operations that define other objectives. We have represented by 0, alteration, modifying a body part for cosmetic purposes without affecting function. This is your facelift or your breast augmentation. Next is creation. It's represented by the number 4. Making a new genital structure that does not physically take the place of a body part. This is your artificial vagina or penis, such as in your sex change operations. G is fusion. It's joining together portions of an articular body part, rendering the articular body part immobile. This is your spinal fusions, your ankle arthrodesis. And then I have questions for you. What is the root operation of a blood clot removal? You can stop the video now if you want, or pause it and answer these questions and then come back. Two, what is the root operation of tonsils completely removed? 3, what is the root operation of lysis of adhesions? 4, what is the root operation of breast biopsy? 5, what is the root operation of lithotripsy of a calculus? And 6, what is the operation of an ankle arthrodesis? Okay, now we're back for the answers. Number 1, what is the root operation of blood clot removal? Extirpation. Number 2, what is the root operation of tonsils completely removed? Resection. All of the tonsils were removed. 3, what is the root operation for lysis of adhesions? Release. Remember your carpal tunnel syndrome. Number 4, what is the root operation for a breast biopsy? Excision. We're only taking a portion. Number 5, what is the root operation for lithotripsy of a calculus? Fragmentation. Fragmentation is the breaking of the stone so it can leave the body naturally. If the stone was broken up and had to be removed by an instrument, by a basket that reached up there, got the stone and brought it out, then the root operation would be extirpation. Number 6, what is the root operation for ankle arthrodesis? Fusion. Okay. Next we're going to talk about the 5th character, which is the approach. Here we have 3 different approaches we could use. We could use open, which is cutting through the skin or mucous membrane or any other body part layers necessary to expose the site of the procedure. We have percutaneous. It's entry by puncture or minor incision of instrumentations through the skin or mucous membrane and any other body layers necessary to reach the site of the procedure. And the last one is percutaneous endoscopic. This is entry by puncture of a minor incision of instrumentation through the skin or mucous membrane and any other body layers necessary to reach and visualize the site during the procedure. That's the difference between percutaneous and percutaneous endoscopic. Percutaneous endoscopic, you visualize when you go in. So images from ICD-10-PCS Optum 360 book. This is the book I use, but there are a lot of great books out there. This shows number 1 is the open, where they've cut open and they're going in. The second one is the percutaneous. The third one is the percutaneous, and you can see they're going in and it's connected to a television screen so you can see. They can see the inside of the body without cutting you wide open. Approaches continued. Approaches that access the operative site via a natural orifice. So you have via a natural orifice opening. This is entry of instrumentation through a natural or artificial external opening to reach and visualize the site of the procedure. Next, we have via natural or artificial opening endoscopic. Entry of instrumentation through a natural or artificial external opening to reach the site of the procedure. And then last we have via natural or artificial opening with percutaneous endoscopic assistance. This is entry of instrumentation through a natural or artificial external opening and entry by puncture or minor incision of instrumentation through the skin or mucous membranes and any other body part layers necessary to aid in the performance of the procedure. And here are some pictures again from my ICD-10-PCS Optum 360 book. The first one is through a natural opening. So we're going in through a natural orifice. The next one is via natural artificial opening endoscopic. So they like doing an EGD. They're going down and looking. And then the last one is via natural artificial opening with percutaneous endoscopic assistance. So you've got your trocars looking, and you probably have a visualization up on the screen. Appendix B, approach continued. The external approach. This is performed either directly on the skin or mucous membrane or indirectly by the application of force. This is your example of closed reduction of a fraction. Remember, they grab it and they pull it to straighten it out. Again, here are the 7 characters we've been studying. Section 1, character 1 is section. Character 2 is body system. Character 3, root operation. Character 4, body part. Character 5, approach. Character 6, device. And character 7, qualifier. I've put in here Appendix C. This is explanation of the PCS characters chart. The first character is section. It shows the medical surgical section and holds a value of 0. The second is the body system, which we've talked about. The body system general anatomical regions should be used only when the procedure is performed on an anatomical region such as the female perineal area rather than a specific body part such as the arm. Sometimes when you go to put in a code, you can find a region or an area that is close, but it's not necessarily identified. So you have to go by the closest region, anatomical region. The body systems are denoted as upper body systems or lower depending on the diaphragm. Remember, your diaphragm is the equator. More review questions to using in your book. You can look up total mastectomy, Look for transfer left index finger to left thumb position open. Look in your book for open fracture reduction right tibia. Look for closed reduction and percutaneous internal fixation of right femoral neck fracture. Number 5, forceps removal of foreign body in right nostril. Number 6, pacemaker placement. The more you look through your book and search and find these different procedures, the better you'll get at feeling comfortable at finding your procedure codes. You'll be able to manipulate through the book rather quickly. Here's the answers for you and the explanation. So if you could pause the video if you wanted to and go back and look for those, come back and check them, or again, they're on the PowerPoint if you need it. Appendix C, I still have explanation of the PCS characters chart. This is the third character, is the root operation. Example is resection or transplant. If the intended procedure is discontinued, you get the patient back there, they're starting to do something, you're going to do an operation, then they start having a seizure, or maybe they go to intubate them and they aspirate. So the procedure is stopped. You would code the procedure to the root operation that was actually performed. So how far did they get in the actual procedure before they had to stop it? That's what you would code the procedure to. The biopsy procedures are coded using the root operation excision, extraction, or drainage, and the qualifier is diagnostic. If a diagnostic excision is followed by a more definitive procedure, such as excision or resection, both procedures are coded. If a root operation is done on overlapping layers, the body part denoting the deepest layer is coded. I just find ICD-10-PCS so much easier and makes so much more sense to me than CPT. Operations continued. When to code multiple procedures. The same root operation is performed on a different body part. The same root operation is repeated at different body sites that are included in the same body part value. Example, different muscles in the body part valued of the upper leg muscle. To me, this is an example of dog bites where they're having to go in and suture different ones. So you would do the same root operation is repeated on different body parts. You would code each one. Multiple root operations with distinct objectives are performed on the same body part, and the intended root operation is attempted using one approach, but then is converted to a different approach. The fourth character, body part. This is a specific body part on which the procedure was performed, such as the kidney. When a procedure is done on a body part that does not have a distinct body part value, then it is coded to the corresponding whole body part. If a procedure is performed on an arterial or venous body part, code the body part value corresponding to the anatomically most proximal, closest to the heart, portion of the tubular body part. If a specific branch of a body part does not have a distinct body part value, it is coded to the closest proximal branch. For example, a procedure is performed on the mandibular branch of the trigeminal nerve, codes to the trigeminal nerve body part value, and the bronchial artery occlusion is coded to the body part value upper artery in the body system upper arteries. Not all body parts denote laterality, left or right side. Those that have a body part choice for left and right should also have a choice for bilateral. If a procedure is done bilaterally, then you choose the bilateral code. If the procedure is only done on the left, then you choose the left. If it's only done on the right, you choose the right. Example, when the identical procedure is performed on both fallopian tubes, it is coded once using the body part fallopian tube bilateral. However, when the identical procedure is performed on both knee joints, it is coded twice using the body part values knee joint right and knee joint left. If a body system does not contain a separate body part value for fingers or toes, procedures performed on the fingers are coded to the body part value of the hand, and procedures performed on the toes are coded to the body part value of the foot. Procedures performed on tendons, ligaments, bursa, and skin, subcutaneous tissue, and fascia supporting a joint are coded to the body part that is focus of the procedure. For example, a procedure that is performed on the wrist is coded to the lower arm, and a procedure on the hip is coded to the upper leg. Upper and lower intestinal tract. In the gastrointestinal body system, the general body part upper intestinal tract includes the portion of the GI from the esophagus all the way down to the duodenum. The lower intestinal tract includes the portion of the GI tract from the jejunum all the way down to the rectum and anus. Coronary arteries are classified as a single body part. The coronary arteries are further specified by the number of arteries treated. When the same procedure is performed, including the same device and qualifier values, one procedure code is specifying multiple arteries is used. Example, angioplasty of two distinct coronary arteries with placement of two stents is coded as dilation of coronary artery, two arteries with two intraluminal devices. Fifth character approach. This is the technique used to perform the procedure. This may be performed through the skin, mucous membrane, through the orifice, or external. Procedures performed using an orifice, such as the mouth, on structures that are visible without any instrumentation are coded as external. Procedures performed by the application of external force that are also coded as external. For example of this is the closed reduction of the fracture. And procedures performed percutaneously by a puncture of minor incision but using a device are coded using the term percutaneous. An example of this type of procedure is the fragmentation or destruction of the kidney stone through a percutaneous nephrostomy. A device is a graft or prosthesis, implant, simple or mechanical appliance, or electronic appliance that remains in the body after the procedure is completed. Only code the devices left in the body after the procedure is completed. For example, a Foley catheter that is left in the body after the procedure is completed is considered a drainage device. Devices that are often used that are not considered, things that are often used that are not considered devices are sutures, ligatures, radiological markers, temporary post-operative wound drains. You would think those would be devices, but they are not considered devices. Sutures, ligatures, radiological markers, temporary post-operative wound drains. Not a device. Foley catheter, a device. Examples of procedures that involve a device include drain tube change, central line insertion or removal, total hip replacement, revision of pacemaker insertion, abdominal wall, herniography using mesh supplements. If a device that is intended to remain after the procedure requires removal before the end of the operative episode in which it was inserted, both the insertion and removal of the device should be coded. So sometimes when you're putting in a pacemaker, maybe when you get it in there, one of the lines isn't right. It's not working. It's not picking up. So then you would take that out. So then you would code both insertion and removal of the device. Procedures done on devices rather than on a body part are specified by the root operation of change. Remember, this was your changing of your Foley catheter, your gastrostomy tube. You have irrigation. This is, often think of TERPs where they leave the Foley catheter in and they have irrigation going through. Removal, where they take out the device, and revision. A separate procedure to put in a drainage device is coded to the root operation drainage with the device value drainage device. This is a diagnostic procedure when it requires a qualifier that identifies drainage procedures that are biopsies. So your qualifier could be your paracentesis, your thoracentesis, your IND of an abscess, your chest tube placement, your Foley catheter placement. These are your qualifiers. In obstetrics, the character may be used to show obstetric injury, musculoskeletal, and external causes. In new technology, the seventh character is used exclusively to indicate the new technology group. The placeholder is shown with a Z if no qualifier is present. The placeholder X is used to fill empty spaces to complete a code, such as T67.4XXA. Let's look at laparoscopic cholecystectomy. In the alphabetic index, cholecystectomy will show as two types: excision gallbladder 0FB4 or resection gallbladder 0FT4. Identify the root operation, the objective of the procedure. Are you doing an excision or a resection? You taking the whole thing out or a portion of it? To determine which root operation is appropriate, the actual body part must be considered. The difference between excision and resection is based on whether all or a portion of the body part is removed. In the example of cholecystectomy, gallbladder is the body part. So if the entire gallbladder is removed, the root operation resection is selected. In the unlikely situation in which only a part of the gallbladder is removed, the root operation excision would be selected. To continue with the example, the coding specialist or CDI would reference the resection entry from the index. So we would look at 0FT4. Next, the PCS code table corresponding to the index entry is referenced. The ICD-10-PCS coding guidelines specify that the code tables are always consulted to find the most appropriate and valid code. Even if all 7 characters are listed in the index, the PCS code table should be consulted to verify the code. So that means you got to flip over in your book to that body section and look and make sure that everything lines up on your row for that gallbladder procedure or whatever procedure you're coding. Now build the code using the 4th, 5th, 6th, and 7th character from the same row of the selected table. It is important that each of these characters comes from the same row in the table. It is not permissible to select a character from a different row in the code table. This is not an issue for the cholecystectomy example because the gallbladder appears in only one row of the resection table. And here is the example. So we have 0FT4 for gallbladder going straight across. The approach is 4. We're going to do percutaneous endoscopic. The device is Z, no device, and the qualifier is Z, no qualifier. So our code is OFT4. Let's see, 0FT4 4ZZ. Practice finding these codes in your ICD-10 book. Here I've given you the code. Last time I gave you the question on what you needed to find. This time I'm going to give you the code and you go and try to find out what these represent. So you can stop the PowerPoint now or the video and go and look and then come back and check and see what we find. Or you can continue on. Here are the resources that I've used. So on here is on here is Centers for Medicare and Medicaid Services, ICD-10-PCS. This is your www.cms.gov for Medicare coding ICD-10. We have Centers for Medicare and Medicaid Services 2023, 2024, ICD-10-PCS coding guidelines, tables, and indexes. Another website is www.cms.gov Medicare/ICD/1/2024/ICD/10-PCS. And your ICD-10 PCS coding book. If you have any questions, just leave it in the comments with your name and how you want me to contact you back, and I will get back with you with any answers to your questions. Thank you.